Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. Today, I'm so excited to welcome one of my longtime mentors and a dear friend, Dr. Kim Kutsch. Dr. Kim Kutsch was raised on a grass seed farm in North Albany by prominent area farmers Mike and Virginia Kutsch, wonderful people. He graduated from Corvallis High School in 1972 and then attended Westminster College in Salt Lake City, where he graduated in 1976. In 1979, he completed his dental degree from Oregon Health Sciences University in Portland, Oregon. Dr. Kutsch started his practice of dentistry in Corvallis in 1979 with partner Dr. Steve Long. In 1982, Dr. Kutsch moved to Albany and took over the responsibility for the dental practices of Drs. Robert Arthur, Larry Riley, and Gene Berg. You're a busy guy. In 1984, he also added the practice of Dr. Craig Marble as he retired. In 1990, Dr. Kutsch became a pioneer in lasers in dentistry and began lecturing internationally on minimally invasive dentistry and advanced laser procedures. He started a dental company locally and manufactured dental equipment and materials. Over the years, he started 7 dental companies and acquired 17 patents, in addition to writing hundreds of articles and 5 books. Dr. Greg Renier joined his practice in 1995, and they formed Kutsch and Renier. They practiced together until Dr. Kutsch retired from clinical practice in 2019 after 40 years to focus on his local dental company, Oral BioTech, manufacturers of oral healthcare products. He reviews for several professional journals, including JADA, the Journal of American Dental Association, Compendium, and Inside Dentistry. Dr. Kutsch also acts as scientific advisor for dental caries at the prestigious Kutsch Center in Seattle, Washington. In 2023, he also started a chart-topping podcast, Contrary to Ordinary, exploring the lives of extraordinary people. He continues to teach, write, invent products, and mentor dentists, inventors, and entrepreneurs. He and his wife Dana live in Salem and enjoy traveling and spending time with their children and grandchildren. Welcome, Dr. Kim Kutsch.
Well, thank you, Kelly. And it's great to be here. I'm looking forward to this.
This is so awesome. So I was thinking about this morning about how I first came to know of you. Mm-hmm. So I was a dental student from 1995 to 1999, and I remember these, dental journals and such coming in, and I would see your face and talking about things like dental lasers and air abrasion. And I'm like, wow, like this guy's really into some cool stuff. And I recall in 2003, I was going to what I would consider my first major dental laser conference down in Dana Point, California.
Oh, yeah.
And you were one of the keynote speakers. And I just somehow I had you on this pedestal of this guy's so amazing, which you are. Huh. And I remember getting up the courage to come introduce myself to you. And you were one of the warmest, kindest, just sweet souls I had ever met. And, we started geeking out about music and it's been 22 years of having a fast friendship. But that's not why we brought you here to talk to us today. There's a lot of other things we want to talk about. Whole health. So going back to those early 2000s, one of the things you introduced me to was looking at dental decay, an experience shared by millions of people around the world, probably billions, to which there really haven't been a lot of answers historically. And I know that you have spent a lot of your career focusing on how can we help people reduce the risk for dental decay.
Yeah.
So I figured we'd probably talk a lot about that topic today. It's come a long way from swishing with iodine rinses, such in your mouth. So maybe if we could start by sharing, how did that become an inspiration for you, and what is the progression of that in your career and companies looked like?
I think, Kelly, when I look back, on my life, it's kind of interesting. because we don't often look back, right? I'm always looking ahead, what's next and what can I work on next and what other new problem can I solve? But, when I look back on that, I mean, it really started to Mike and Virginia Kutsch on the farm. Like, I was a very curious child, and they kind of encouraged that. And so I was curious all the way through my educational process, and even through I was the problem dental student because I would ask the professor, well, that doesn't even make sense. Why do we do it that way? And they'd go, well, because that's how we've always done it. And that was like the worst possible answer you could have given me, right? And so I think I've always had that curiosity, and I've always kind of fostered that in my own career. And I got involved in lasers. And I thought, this technology has to be able to improve something that we do in dentistry. Like here's this technology. Let's see what we can do with it. And I used it to treat initial small cavities. And, I thought, well, this is going to help us solve the problem of, tooth decay, right? We're going to be better at it because we have a laser. And it really didn't change that. And by the end of the 90s, of course, I'd built a number of dental companies. And by the end of the 90s, I really came to a point where I woke up one day and I realized what we're doing doesn't work. Like, if what I was taught and how we were trained to treat cavities, drill and fill dentistry, if that worked, it would work. Mm-hmm. And I had all these patients and now I'd been in practice in my hometown. I knew most of my patients for my entire life, or they knew me. And so they're friends and family. And they just kept getting cavities. And I kept telling them I was doing what I was trained. They were doing what I was asking them to do, but yet they just kept getting cavities, and they were frustrated. I was frustrated, and I had this epiphany. It's like, this doesn't work. And I thought, I'm missing something, and I realized I didn't really understand the disease. Like, I thought, after all of this, here I am, I spend most of my day doing this, treating this disease that I don't really understand. And so I thought about going back to school. I'd sold the company. I'd been on a sabbatical from my practice for about 2 years. And I really thought about getting an advanced degree in cariology, right, in the study of that disease. And I thought, I don't need a degree. What I really need is the knowledge. And it was really the birth of the internet. And I was able to contact all these researchers, the best minds in dental caries worldwide. And every single one of them was happy to mentor me. So I had this list of mentors. Suddenly I had access to everybody globally. And so I started studying. I went to the IDR. I subscribed to Journal of Dental Research, Journal of Caries Research. I dove into it like head first. And I thought, I want to learn everything that I can learn about this disease, so at least I can understand it. And then if I understand it, maybe I'll be more effective at trying to figure a solution to it, right? And one of my mentors ended up being John Featherstone. And I really, you have these epiphany moments in life. And I'll never forget where I was. I was with he and No in Adelaide, in the Barossa Valley in Australia. I'd been teaching at the university there, minimally invasive dentistry. We were drinking wine in the afternoon. It was a jazz festival. And he just kept asking me, how do you diagnose dental caries? And I said, microscope, digital radiographs, caries detection dye, Sharp Explorer, and he says, yeah, but how do you diagnose dental caries? And so I repeated myself a little slower and a little louder, right? But that's how you identify a cavity, but how do you diagnose dental caries? And it was like, for me, the light went on. I'm like, oh my gosh, it's a disease, and we're just identifying symptoms and signs and symptoms of this disease. And I came home, and I contacted John Featherstone. I said, I get it. Finally, I get it. We're doing this wrong. You've got this sorted out with caries risk assessment, looking at the risks that are driving this disease. I've learned this from all of my other mentors, like Phil Mars from Leeds University, Edwina Kidd. I mean, I can go down a long list of wonderful, warm, incredible human beings. And I'm like, how do I do this? And I'll never forget, he says to me, well, nobody knows how to do it. We just know that we should be doing it. And I'm like, it's like the year 2000, and we finally understand how we should be doing it, but nobody knows how. I mean, this is what we should do, but nobody knows how to implement it. And I told John, I said, I'm going to figure it out. I said, that's it. I'm going back to my practice, and I'm going to figure it out. And it was quite a challenge. I made a lot of mistakes. You learn from those things, but that started that whole process for me. And then as I got further into my practice, I realized I needed different products, oral healthcare products, than were available on the market. And I'd built a handful of companies, so I knew how to do that, right? And unfortunately, I knew how to do all of that stuff. So Doug Young and I got together, and we, with my son-in-law, started a company, Oral BioTech. And we started to develop products that would more effectively treat the biofilm disorder of this disease, that component, and understanding that science. And it's grown from there. I mean, that was 24 years ago. We started actually 25 now. We started the company. And so it just took me down that pathway of more research, better understanding. We've learned so much more about this disease in the last 25 years. The challenge we've got is, while we've gotten better at it, the risk factors have increased, like the amount of sugar that we consume in our diets, the American diet, and particularly when you talk about whole health. You look at all the ultra-processed foods that we eat, the amount of sugar that's in there, the prescription medications people take today, which also reduces their salivary flow, which is what protects the teeth from cavities. So you've got this, we're out of balance there. So in spite of the fact that we've gotten dramatically better at figuring out how to treat this, address the disease itself, we haven't made any dramatic improvements in the incidence of tooth decay in the United States because these risk factors have increased, right? So like the diet and the behavioral patterns of people have changed as well, and made it harder for us to deal with. So anyway, that's kind of what got me here.
Wow.
That's
a long-winded answer, but
it's a great
awesome
answer. Yeah. And it now, of course, per usual, I have a lot of questions. And can I ask my first one?
Go right ahead,
and then I won't monopolize.
No, it's great.
Is there a singular cause of the disease?
No.
Okay.
And so the major risk factors are saliva, diet, and biofilm.
Okay.
Right? And then there's a genetic component. And at the end of the day, it's all about the pH in your mouth. So if you have these prolonged periods of low pH, that leads to mineral loss out of the teeth, which leads to cavities. And if you don't have those prolonged periods of low pH in the mouth, you don't get cavities. I mean, you don't get the disease.
Period.
So period. But for every individual, this is where the challenge is. Like, we tended to think as a profession at dental caries being a cavity. And we would drill and fill, right? Problem solved. Didn't change the biofilm and all the risk factors and all the things that cause that cavity. We hadn't gone upstream and treated the cause. And so, when you look at that cause for every individual, it's different, right? So it might be for some person what's driving their disease is they're taking 5 prescription medications. They've got a really dry mouth, and so that it doesn't protect their teeth, and they're very susceptible to getting cavities, right? And I can't take that person off their medication, so I need to figure out how to balance that so to create a healthy oral health and balance in their mouth. But for the next person, it might be they snack all day long, and they eat a lot of sugary snacks and ultra-processed foods. And for another person, it might be their home care. Maybe they don't brush and floss and take care of their teeth well from that standpoint. And then you've always got this genetic component. But at the end of the day, it's those prolonged periods of low acidic episodes that are in the mouth. And so for every patient, if I can, this is what I tell dentists and hygienists and dental professionals. I think when we look at a patient, the first thing we cue in is like, how many cavities do they have? We're looking for cavities. And the most important question is not how many cavities they have. The question we should be asking is, why do you have cavities? Because if I can figure out for you, Kim, what your exact risk factors are that are causing those cavities, and we can fix that, you become decay-free. And you can be decay-free for life. So it's like there's no one singular cause. The problem is, traditionally, we gave a one-size-fits-all treatment, which didn't work.
Well, yeah, symptom management almost, right?
Yeah.
So that makes me think about, as a functional nutritionist, people come into my clinic all the time and they say, well, I just grew up with bad teeth. And so you said genetic a couple of times. So I did wonder, do some people have teeth that are just more vulnerable? Are some people born with or just naturally have a pH that's lower? What are the things that are sort of the precursors?
You've got these biological variables. I mean, every human being is different. I mean, you can appreciate that, right?
Of course.
And how our bodies respond to the environment and the food and all of that varies between people as well. So it's like, it's not that easy. Again, that one size kind of fits all treatment just doesn't work. Going back to that particular topic on as a nutritionist, people come in, do they have soft teeth? I can remember being in dental school and I'd have a patient come in and it'd be, oh doc, it's not my fault. I was born with soft teeth.
Yeah.
And I can remember us dental students getting together and telling these stories at lunch, and we'd all laugh, ha ha, he had soft teeth. But the reality is, it's like, not my fault, doc. I was born with soft teeth. There's some truth to that. There's a bit of truth in that. There are 60 genes now that have been identified that play a role in dental caries. Some of them are taste genes, like super taster kids that are sensitive to phenol, so they choose not to eat cruciferous vegetables. And then you have people that have a sweet gene, which they choose sugar. I mean, they become more addicted to sugar. So some of those genetic influences also influence our behavior and put us at greater risk. But there's a lot of genetic influence. However, Alex Vera, I think the world's leading expert in dental caries and genetics. I spent a lot of time with Alex, and I posed that question to him, so what is the real genetic risk? Because it's kind of an unknown. It's out there. And Alex says to me, oh, I know exactly what it is. We ran all the numbers. And I'm like, well, I'm on the edge of my seat. What is it? He goes, population-wide, it's 9%. So it plays a 9% role in tooth decay, which is not that big of a role, right? I mean, certainly not like diet or saliva is. So I was a little disappointed, but then you have to go back. That was for the population, but for an individual, it may be 50, 60, 70% of us driving their disease. And we don't do genetic testing yet. So I know what genes have been identified, but I'm not able to test a patient to say, oh, you have this gene and this puts you at risk for this reason. And here's how we can mitigate or account for that and try and get you into a whole body health, right? So there is a genetic influence there. And that biological variability, I mean, we're all, I think, keenly aware of the fact that we're all put together differently, right? I mean, we have a lot of common things, and traits and experiences, but that biological variability, I think, is what makes it hardest for us, but also gives us an opportunity to individualize healthcare, personalize our treatment plans for people and actually become much more effective at health, rather than chronic disease management,
So the pH, you said, is really the variable that we can control for in a lot of ways, but the pH has to be at a certain point for there to be a cavity.
Yep.
Okay.
Yeah.
And some people might be more vulnerable, whereas others, for lots of factors. Can you test the pH of your mouth?
Yeah, and the challenge with that, and you can, certainly, right? You can use a pH strip.
Okay.
But the challenge with that is the pH in your mouth is changing all the time.
Okay.
So just taking one point in time doesn't really give me diagnostic data that I can really make any recommendation from, right? It's a great educational tool, for patients to understand that every time you eat, it creates an acidic episode, and then your teeth demineralize. And then 30 minutes later, if you have enough saliva, they remineralize and they recover. And we want to get you into this healthy balance. And so you get out of balance by either eating too frequently or eating too much sugar, which produces acid in the mouth like that. And so we want to get you back into a balance, having that patient understand, okay, you want a sugary snack. Okay, I get that. have it with a meal, right? Don't nibble on a donut all day long. Just do it once, get it over with, right? I mean, but we have, Americans are grazers these days. We used to sit down to 3 meals. That doesn't happen anymore, right? So people are eating in their car, they're eating at their desk, they're eating continuously. And so if they're also taking a prescription medication, their mouth is dry, they don't have enough saliva, it doesn't take 30 minutes to recover, it may take 2 or 3 hours. Well, they're already eating again, and pretty soon you're in that acidic episode like all day long, and that's where you get into trouble, and that changes the biofilm, changes the microbes that are in the biofilm, and it also changes the behavior of the biofilm. So the biofilm becomes more acid producing. And then you get into that vicious cycle that just feeds on itself, right? And that's frustrating for patients. It's frustrating for dental professionals.
So that makes, sorry, you go because I could just keep going.
I wanted to ask because in terms of, we're talking about a lot of things that increase risk factor, which is so important. When I think back to when we first met, and I think of some of the tools that at that time, we were recommending, like MI paste.
Yeah.
The idea of introducing lactose encoded or encrusted calcium and phosphorus or whatever it was. Yeah. Things have changed over the last 20 years.
Yeah.
What are you finding today that there are things that you can put into products that actually help improve risk for people who?
Oh, yeah, absolutely, Kelly. And that's a great question. pH is like the most important factor in that, right? And when I first spoke with Philip Marsh, and he's the one that actually had all that pioneering research on pH and the biofilm back in the late 1980s. This has been a while, right? And so when I contacted him in 2000 and started asking, I was reading all this research, but I just kept coming back to his papers. And I thought, if this guy's right, like he may have figured out how we can solve the biofilm component here. He never published that. He just published how the biofilm got dysfunctional, but not how to treat it. And so one of the first questions I asked Phil was, well, since the low pH is driving the biofilm into disease, could we raise the pH of the biofilm and would it come back to health? And he goes, oh, absolutely, we did that. And I'm like, well, why didn't you publish that, right? And he was, we were just interested in trying to figure out what was driving the biofilm, right? And so they did that. And I said, well, have you got that data? Could you share? He goes, oh, that's on a floppy disk on a software program, doesn't even exist anymore. And I'm like, oh, but you're telling me that if I raise the pH, I can improve the health of the biofilm. And he goes, absolutely. So Doug Young and I still had a scientific laboratory from one of my other companies. And so I thought, well, this is going to be easy. We'll go to Walmart. We'll buy every product on the shelf. We'll take them back to my lab. We'll test the pH. We'll find the one that has the highest pH, and I'll start using it on my patients and see what happens. And I had no clue. I got there. I couldn't find a product that had a pH over 5.5.
Wow.
Which is that critical pH in the enamel where it starts to dissolve. And a lot of them were 4.3. There's one company that still holds the record in my lab at 2.87, and it's like I was just shocked, and I had no clue as a dentist. I didn't know that, and so I looked at Doug and I went, "We're gonna have to make these for ourselves." Right. And, there we go. Fortunately or unfortunately, I knew how to do all of that. So we started making products at an elevated pH. And then I discovered why there are no products with an elevated pH. And that's shelf life stability. At a pH of 4.3, nothing wants to grow in it. And all of our preservatives are most effective and active in that acidic range.
Of course.
You get a pH of 8, everything wants to grow in it. And so it took us 4 years, and a team of engineers and scientists, and Doug and I, it took us 4 years to figure out how to stabilize it. And we did. We figured it out. And that's kind of a trade secret.
Yeah.
But we started doing that, and immediately when I raised the pH and had helped patients, and now I know that the products that we have test data now that even after 20 minutes of continuous sugar exposure, they're still alkaline. The pH in their mouth in the biofilm is still alkaline. And so it's very effective. And so we built an entire product line around that. And so Kelly, about the time I met you, I was working with that elevated pH, and my patients immediately quit getting cavities. Right?
Incredible.
I mean, it was like that. It worked. But you ask about other things. Well, certainly fluoride, although I don't know if we want to get into that hot topic, but fluoride certainly plays a role in remineralization, protecting the teeth. Nanohydroxyapatite is an ingredient that you're going to see more and more of. And that it's actually biomimetic. That's what the enamel's made out of. And the more biomimetic you can make your little crystallites of enamel and this is what your body does. Your body bathes your teeth in saliva that's super saturated in nanohydroxyapatite crystals all day and all night. And that's what keeps your teeth crystallized and protected. And so putting that in a product is a great ingredient that helps keep the teeth mineralized and healthy. It's a great replacement for fluoride. Nanoparticles come with some risk as well as the benefit. Everything comes with a risk,
yeah,
right?
Of course.
And I always like to think risk and benefit, right? So you got that benefit. The risk is with nanoparticles, particularly in these little crystallites, is if they're needle-shaped. And so if they're needle-shaped, they can penetrate soft tissue and travel throughout the body. And so that's bad, right? Mm-hmm. And so there's one core manufacturer of that ingredient that has actually been tested, been approved by the European Union and confirmed to be safe and not have any needle particles. And so that's the ingredient, that's the company. We were actually their first customer. That's Fluid Nova. That was back in 2012. And they're based in Portugal, and that ingredient is NanoXIM. And so that's a safe ingredient. If I see that on a label, I know that it's safe. But those are xylitol is another really great ingredient, and so that makes it harder for the biofilm to stick to the teeth. It also reduces the metabolic output of the biofilm as well. So that's a real great protective mechanism. So you add kind of those. So that's what we did. We added all those ingredients together, found a really good balance of them that was effective, and then in an alkaline pH to help create a healthy biofilm so you have a healthy mouth. One thing that's interesting, I know this is about whole body health, right? One of the things that's very interesting is we've known in dentistry now for well over 20 years that periodontal disease, the periodontal pathogens contribute directly to, and some are causative in peripheral vascular inflammatory responses, right? Heart attacks, strokes, etc. And I always thought, I wonder what role the pathogens that, these microbes that we see in dental caries and tooth decay, I wonder what role they play. And we're seeing more and more scientific evidence. We know that some of those pathogens play a role in strokes, microbleeds in the brain. We know that they're beginning to get evidence that they play a role in the atherosclerotic plaque and also on heart valves. So, I've always said you can't have a healthy body if you don't have a healthy mouth, right?
Amen.
And I just read a report this morning where scientists are connecting the biofilm in the mouth microbes with depression. Right? I mean, we've got gut microbiome that we're now connecting to a lot of things like that. Certainly. But now we're talking about oral microbes as well. So it's really important to have, for total body health, to have a healthy mouth. Right? So
we're paying really close attention to that research in the clinic with regards to Alzheimer's disease and cognitive decline, because we're seeing those microbes cross the blood-brain barrier. Yeah. But if they can cross any barrier, they can cross any barrier.
Oh, yeah. And absolutely.
So the pH is the factor here. So I'm thinking about, you kind of know if you have a cavity. I mean, most of the time if you are going to the dentist, you have a cavity, but you're not thinking about it necessarily as a disease. You're thinking about it as a one-off. And aside, or a two-off or a three-off, right? Aside from nutrition and maybe some genetic factors. I'm thinking about other risk factors, like what came to my mind is mouth breathing or, sleep apnea or something. But what are some of the things people should be thinking about that increase their risk?
Certainly, prescription medications are the big one.
Okay.
Dry mouth. So if you wake up any time of the night, or if you have a glass of water on your nightstand, if you feel like any time of the day or night you have a dry mouth, that puts you at increased risk because it's that saliva that's with the nanoparticles of hydroxyapatite and the pH of the saliva is bathing and protecting the teeth. So you kind of cut down that protective mechanism and suddenly you've got increased risk right on the other side of that. So that's one of the big ones. And, the data we've got, I look at the amount of sugar Americans eat. We were talking about diet. Americans eat an average of 23 teaspoons of sugar per day. And I always tell, dental professionals, go home. I want you to go home and get out a baggie, get out a bag of sugar, get out a teaspoon and measure out 23 teaspoons of sugar into a baggie. And I want you to know what that looks like because that's what your patients on average are doing every day. And then the World Health Organization, when they get really serious, they keep refining the recommendations. And if we were really, really honest, we should only eat 2/3 of a teaspoon of sugar per day. And I tell people, so then go pour out, 2/3 of a teaspoon in another baggie and then hold the two up and look at them. Because this is what we should be doing and this is what we are doing, right? And when it comes to high fructose corn syrup, is another hot topic. Americans are number one in the world in consumption of high fructose corn syrup at a rate of 51 pounds per person per year. A 50-pound bag, that's how much we consume. It's hidden in all of our food supply, right? To put that in perspective, Mexico is number 2 at 32 pounds per year.
Wow.
We are off the charts, right? So then when we go back to medications, and we have all this data, there's about 4,000 medications now, 1,100 that are very typically prescribed, commonly prescribed. Those 1,100, the number one side effect is dry mouth. 70% of all Americans from 6 months on, 70% of all Americans take at least one prescription medication per day. 50% take 2 or more, 20% take 5 or more. We have 17 million adolescents in the United States taking psychotropic drugs for depression, anxiety, ADHD, and it's like those psychotropic drugs have a really profound impact on saliva, typically. So the next thing that I want to talk, that I would want to talk about with patients is dry mouth. You feel like you're experiencing a dry mouth at any time of the day or night. You brought up mouth breathing. That's another great risk factor. Interrupted breathing. We're starting airway that is becoming a real, I think, awareness in our profession. That we need to address finally, right? It's kind of funny because this is our domain and it stops right here.
Right. And this is our domain, but we just don't want to talk about this part at all.
Yeah, exactly, right?
I don't know what's happening there.
Yeah. So I think mouth breathing certainly increases your risk because it dries your mouth out if you have your mouth open like all night. Lip taping is, a big thing, but you got to be able to breathe through your nose. And so, I'm going through airway stuff right now myself, orthodontics at age 70. I had a deviated septum, I've had nasal surgery, and I got to tell you, I have more energy than I've had in a long time, and my blood pressure is coming down. All the stuff that you expect, it's all happening. And of course, I'm a little over the orthodontics at this point, but I get everything off this month.
Yeah, nice.
And so I'm pretty excited about that. But it's real, right? And so those things all play a role in creating your risk for tooth decay. And so if you can address and look at all those risks, like I said earlier, if I can figure out why you have cavities, I have an opportunity to help you get healthy. And if I don't figure that out, or if I don't even ask those questions, you're going to continue to get cavities until you run out of teeth or die. It's as simple as that. And I came to that conclusion about 25 years ago, and I can only think of one. It's stupid. It's just stupid, right? Not to go up and start treating the cause. And I'm encouraged by, I think in medicine, we're starting to see people start to think about, well, rather than take this drug for your, type 2 diabetes, let's talk about diet and exercise. Let's see what we can do behaviorally or, in your environment to reduce the cause, for your disease, and see if we can treat that. And so we're starting to see that. So I'm encouraged by that. Go ahead.
I just was thinking about when you're explaining the interaction with just specifically sugar and the pH of the mouth,
Right.
Then would I deduce from that sipping on sugar, I'm thinking about, I work with a lot of teenagers and young adults that, yes, there's an ADHD component and they may be on medications, but they're also, and I'm just going to say it, drinking Dutch Brothers all day. And I say like, that's 70 grams of sugar, but it's also suspended over a few hours because they're sipping. So higher risk than sitting and eating sugar just because of that constant exposure?
Absolutely. And so our mantra is gulp, don't sip. It's like, you want to have the Dutch Brothers, have it. There's nothing against Dutch Brothers, Starbucks, or whoever. If you just want to have that coffee that's laden with a lot of calories and sugar, have it, but have it in association with a meal. That reduces your risk. The more you can contain those episodes, like, into like 3 separate episodes during the, breakfast, lunch, dinner kind of thing. John Featherstone's research indicated if you just snack twice, in addition to 3 meals, you've increased your risk for dental caries. And I think of one patient I had, he was a veterinarian, an incredible guy, athletic specimen. He was an ultra marathon runner. He ran 100 miles a week just for training, for fun. And I'm like,
he was eating a lot then.
Yeah. And so he was eating, there's a supplement for runners, and it's basically frosting in a tube, right? And he was eating like 5 packs of these every day at work. He'd have one in his lab coat while he was, seeing cats and dogs, and he would squeeze this stuff out all day. Suddenly, he's getting like 5 new cavities a year and he was healthy. I mean, the man had like zero body fat.
Yeah.
I mean, he was a specimen.
Metabolizing the sugar, but it's changing the pH.
Exactly.
Yeah.
And he was just continuing to consume it, so his mouth never had an opportunity to recover, and suddenly he was like a decay disaster. And a dentist referred him to me, and I mean, literally, we sat down and sorted that out in like 20 minutes, and I said, I understand you've got a carbohydrate load because of what you're putting your body through, but could you do it all at one time, right? Just at the end of an hour before you go for your training run after work, eat all 5 packets, and then rinse with water, tap water preferably, something that's not acidic water. And then, and he's like, that's it? I'm like, yeah, that's it. Right, because he had a great diet. Otherwise, everything else was like, excellent and great home care. He became decay-free, like literally next month, So it's just, he didn't know what he was doing wrong. And if we in traditional care would have just said, we need to brush and floss better, here's some more fluoride, I'm going to drill and fill the cavities. Well, you just keep doing that over and over and over. And if nobody ever stopped to address the cause, it's just a cycle, right? So anyway.
Yeah. And a frustrating one.
And a frustrating one for everybody. Sure. Yeah.
Having worked with, humans in healthcare for about 30 years now, one of the things I have observed is the shift from current behavior to desired future behavior isn't always overnight.
Really?
I know, it's a shock. And one of the things I so appreciate about what your life's energy has created are products and an understanding, an education, first and foremost, but great products that help bridge that gap between like, well, excuse me, I mean, I even think about as a 20-year-old and maybe early 30-year-old, like, man, I was drinking sodas. Like, it's just, I grew up drinking sodas, woo, drinking my sodas. No decays because I gulped.
Right.
My entire life, just 10 minutes, it's gone. But understanding like, okay, I want to shift out of that. That took me probably 5 years to, go from this type to fizzy water to then just plain water. It took a while.
Yep.
So where can people go to learn about what you've created?
Right.
So that they can be more informed and understand, like maybe they're trying to make these shifts nutritionally, but they've got habits.
Right.
Where could they go learn about this?
So on our website, CariFree.com. If you're a consumer, CariFree.com. It's CariFree.com. There's scientific information on there. There's risk assessment. There's everything that you need to know. And there's products and recommendations for products as you can go through and figure out. You can go to your dentist, ask about that. If you're a dental professional, we have a professional website, CariFreePro.com. And I've got all of my information there. I wrote a book, probably been 3 years ago now. It's titled Why Me? And it was like the unfair reason why some people get cavities and others don't. And it was really a self-help manual for self-discovery. Why am I getting cavities? Why me? And it goes through all of those risk factors. And then at the end of each chapter, it talks about, here's 3 steps you can take to help correct that, right? But yeah, the products are available. They're available on Amazon. My team wanted to offer to all of your listeners a discount. So whether you're a professional on the CariFree Pro site or on a consumer on the CariFree site website, the discount code is Kelly15.
Oh, thank you very much.
So they get a 15% discount on their first order if they want to try the products. But yeah, so that's where they can go. A lot of that information is there. The Why Me book has won 3 nonfiction awards. It's really helped a lot of people. I continue to hear from people how much it's helped them understand. And I even hear from dental professionals, they read it and went, now I get it, right? And so that's worked out really well. So they can find that either at either one of the CariFree websites or on Amazon as well.
That's awesome.
Yeah. Great.
Well, I got to share, I mean, I was a part of your beta test team over 20 years ago.
Yeah.
And what I can say as a provider is it works.
Yeah.
The education first and the awareness creation and the utilization of the pH management systems you've created really work. And it's just so cool to see people who have oftentimes been frustrated by a lifetime of dental decay and the money and time and discouragement that can create. I just really applaud you for diving into your inspiration and your epiphanies and creating such huge and real changes for people. It's awesome.
Well, thank you, Kelly. Once in a while, my team and I will be working on something and we'll be frustrated. It's not going the way we wanted it to. And sometimes you just want to abandon it and go, that's too much trouble. But it's like, and particularly right now, we're working on a product line for patients that suffer from oral cancer or are cancer survivors of any cancer. And we have 18 million cancer survivors in the United States. And of any cancer, 16 of the 20 postoperative complications are found in the mouth. And so, and there's really nothing, there's no product out there that really, it's a real quality of life issue. So we get frustrated. And yet I tell my team, it's like, we have to do this. Like, you understand, like, nobody else is going to. Or they would have already. So it's on us. Like, we have to figure this out. And so we just, put our shoulder back into it. But thanks, Kelly, for that. It always makes me feel good I always love hearing from practitioners and patients, as well, that, if we made a difference in your life, share that with me. That keeps me going,
Yeah,
so,
certainly.
Yeah.
Well, and I think it's a really important conversation that we're having with providers, integrative providers, functional medicine providers, people that are trying and working really hard to pay attention to the whole body, right?
Oh, yeah.
And I do this every day. I work with these people every day. We're all talking about all the different pieces, and still, most of the time, we're leaving out the mouth. And part of it is because the mouth isn't connected to the rest of the body, obviously. Right. And part of it is because it feels like the wild, wild west to us because we don't learn about it. We don't know what to do with the information. Somebody comes in and says, I've had 12 cavities in the last 2 years. It's like, bummer. What do we do next? And so this type of resource is so essential for us to build our confidence that we not only assess it, but then we have tools and research to be able to support those next steps for our patients.
Yeah, absolutely.
Yeah, it's really important.
Yeah, Kelly, I want to go back up for a second on something. You said, in your own experience and your practice, it worked, and patients stopped getting cavities. And I think the elephant in the room here, if for dental practitioners who are listening today, is like, well, if my patients stop getting cavities, like, what am I going to do? And it's funny because I can remember in the early days, I would have my patients say to me, well, doc, if this really works and I stop getting cavities, aren't you like putting yourself out of business? And I'd always laugh and go, yeah, that's my goal here. Like at some point in time, I want to retire and I want to put myself out of business. Like that is the ultimate goal, right? And I thought maybe perhaps I was doing that. And ironically, once I got patients decay free, and they were decay free for like 2 years, and they felt confident in their health and they felt like they were in control of their health, they wanted all this elective dentistry done. Ironically, I went from thinking that I was going to be putting myself out of business and be doing like all this minimally invasive care. I went to doing all these full restorative cases. I was busier the last 20 years of my practice doing large restorative cases than I was in the first half of my career, right? And I didn't see that coming. It was right, and I talked to so many practitioners that had that same experience, and so there was I think a reluctance on our part to embrace that, like what's going to happen. But let me tell you, when you get patients healthy, it's magic, I mean, and the emotional rewards you get from that, from helping people, getting them healthy, is like it's the joy of life, right? So anyway, I just wanted to point that out.
Well, thank you for coming on the Whole Health Podcast. We always like to finish here, Dr. Kutsch, with what does whole health mean to you, and what would you like to impart to our listeners?
I think, when I think about whole health, or I think about wellness, right? I think we traditionally thought of, I want to be disease-free, right? I think that was kind of our concept of wellness. It's like, well, you're disease-free. I don't see it that way. I think I want to thrive. Right? I want to not only be healthy, I want to be healthy to the point that I'm thriving in life, right? And I have energy and I'm doing the things that I enjoy, and I'm able to do that for as long as possible, and, create joy in my life and have my life create joy for others, So that, for me, that's the whole concept of total health.
Mm-hmm. Well, you are so successful in so many ways, but one of the ways in which I'm so grateful, for your success is like you help me want to be a better person at what I do. I've just so appreciated your mentorship and leadership and friendship over all these years, not to mention the music that we've played over the years together. Dr. Kutsch is a phenomenal banjo player. We love having fun with that, a couple times a year. So anyway, thank you so much for coming on the Whole Health Podcast and sharing your wealth of information and knowledge and also inspiration. I think this is going to help impact a lot of people very positively.
I do too.
Well, thank you both. And I just want to say, I'm so inspired by you all doing this podcast and the message that you're getting out to people about health and how they can become healthy and look at that as a whole person health, right? I'm really inspired by what you've done, Kelly. It's been so much fun watching you grow in your profession. For me, just really rewarding.
Thank you.
And Kim, it's great to see you again.
Nice to see you.
So thanks, guys. I appreciate it. Well, I hope your audience learned something today, and maybe they can take something away and become healthier in their own life.
Thanks for being here.
Yeah, thank you so much.
Appreciate it. Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.